Well, hello everybody from a warm and sunny London here. My name's Tony Hunter. I'm Chief Exec here at the Social Care Institute for Excellence, a social worker by background, and a big welcome to this webinar on relationship-based systems in children's social care. We've just been looking down the list. There's 92 of you online at the moment. Hopefully that's going to hit 100 shortly, and you're from all over the place. Walsall, Dublin, West Wales, Devon, Derby, somebody from Melbourne, somebody from Jersey. So this is a truly sort of international webinar. Again, a big welcome. I'm just going to do some quick introductions here, and then I'm going to say a little bit more about how we're going to spend this hour. So over to Ryan.
Hello everyone, my name's Ryan Wise. I work here at SCIE. I'm a children's social worker by background and now work in practice development here at SCIE.
Hello, I'm Yvette Stanley and I'm the National Director of Social Care at Ofsted.
My name's Tim Fisher and I'm the Service Manager for Family Group Conference and Restorative Practice in Camden. Hello to Webinar Land. First time I've done a webinar, and it's really nice to see all of the names on there. I can see some people I know as well, which is great. Beverly! Shout out to Beverly! Love it!
Hi there, and I'm James Owen, and I'm actually between jobs. I work for Camden. I'm a children's social worker, and I am starting a new job on Monday where I'm going to be the service manager for looked after children and care leavers.
And hi guys, my name's Kevin, and I'm Family Rights Group's trustee, and I play a key role inside Family Rights Group. And I'm also What Works for Children stakeholder member. And I also work really closely with Camden on the FAB group.
So as you see, we've got a motley but very impressive crew of all-stars here to entertain you today. But much of the entertainment will be provided by yourselves as well. We're up to 97 now. You'll be able to see, of course, the comments that you're making. You'll make it's a great networking opportunity. You'll make links with each other as well. We want this to be as interactive as possible. We've got loads of material, but we're not going to be slaves to it. We're going to follow themes and conversations as they arise. So here and there it might even be a bit messy, who knows, but that doesn't matter. I'm hoping for really informative and productive hour. A reminder that you are going to get copies of all the slides. I don't think we'll manage to get through them all. That doesn't matter. We'll use the time as effectively as we can. So you'll get those. You're also going to get a recording of this event, and you're also going to get a list of each other's email addresses so that you can continue the relationships and networking after the event as well. This is billed for an hour. Typically we try and finish about 5 minutes early to help you get back to whatever you're supposed to be doing at 1:30. But you know, let the debates continue as well. Right, so quickly from myself then, relationships and strengths. The relationship, and you'll be able to see the slides of course as we go through. Relationship-based social work is not new of course, but its impact as being the absolute core of service design and delivery has recently become much more prominent, permeating the whole system, not as if you like, as a separate entity. And here at SCIE and with colleagues, not least in Camden, we've done a lot on strength-based approaches, trying to look at what it is that children and families wish to contribute, the strengths people have, assets they have, and ways that people can support each other, not simply look through a deficit lens, if I put it like that, really. Relationship-based systems also linked to co-production. Ryan, you're going to be saying a bit on that in a little bit, aren't you? How we involve children and families in every aspect of service design, delivery and review. So, with no further ado, I'm going to hand over to Yvette. In the smooth and well-oiled machine.
Yvette's failed to click the right button, so apologies everybody, and thank you Tony and colleagues for joining us today. Each day social workers take life-changing decisions, and we know that our best practice takes place when our practice is child-centred, family-focused and relationship-based. That's why the social work standards and knowledge and skills statements have relationships at their core. And I'm going to talk a bit about what we've found through our Ofsted inspection framework, where we look at the impact of leaders and talk about creating the environment, the culture, the ethos, the operating model for the very best practice to thrive. So whilst Ofsted won't endorse a particular branded approach, we won't put out a kite mark on a name. We do, in very much bake-off style, talk about the essential ingredients and the need to mix them well and to take care in the baking and the implementation. It's absolutely key. I might have to get Ryan to do my jiggly. I've lost the cursor again. So the name of the model alone doesn't tell you what it is or what it does, we find when we visit places on inspection and focus visits. The same model can be implemented quite differently in two areas, and one approach won't be necessarily right for each and every locality. However, in local authorities furthest along the journey, we've identified relationship-based approaches as a key ingredient. Put simply, leaders must create a culture, ethos and operating model which supports authoritative but empathetic and compassionate relationships at both system and operational level. And I know Ryan is going to talk about co-production, and actually those relationships, co-production, are pretty key. In Hillingdon, we saw their dedicated and knowledgeable leadership team modelling a child-centred approach to all strategic and operational interventions with children, and we saw this replicated through the whole staff group. Vision and approach must be translated into practice, and to be confident practitioners, the workforce need to be equipped with the language, knowledge, tools and skills to deliver that chosen model. They need to believe in and own the model. And where there's been that active engagement in co-production, we find that the practitioners understand both what's expected of them and what success looks like for children and families. But you need to get the basics right, and to deliver strong relationship-based work, you need structures which deliver spans of management, which empowers practitioners but hold them safe with managing those difficult risks. And practitioners need manageable caseloads to enable purposeful direct work with families. Timely work needs to be assisted by handovers, and transitions need careful planning, underpinned by a shared understanding of what services are expected to do, and a quality assurance system which reflects values, not just standards and expectations and what's easily measurable. Keeping relationships at the heart of best practice means regular, high-quality reflective supervision, the space to reflect safely with our manager on what we've done well, and where we haven't done our best, what we've learned from it. So some of those ingredients, a family-based approach, models that tend to have the biggest difference, make the biggest difference to the progress and experience of children, take a whole family holistic approach, harnessing through co-productions the strengths of the wider family network, facilitating the co-production of plans and their review. They address key needs and risks while identifying and utilising all of those wider families' strengths, drawing on that wider network. We saw this very much in Bexley, where the ethos behind their well-embedded social work methodology is that children should grow up with their own families or the wider family network when it's safe for them to do so. Family-based relationship work starts with that whole family network and is supported and underpinned by direct work with families to safely keep their children at home. Stable relationships are also key, aren't they, colleagues? Most models focus on the importance of stable relationships with social workers as a critical element in achieving sustainable positive change. We saw this in East Sussex, where their model of connected practice supports practitioners to create change through sustained relationships with children and families, resulting in helpful, enduring, trusting relationships between practitioners, children and their families, sometimes over many years. We saw this again in Leeds, who have a well understood practice model that promotes child-centred work. Everybody is clear what successful outcomes look like. They use restorative approaches which promotes working with a family rather than doing work to them. Families own their plan and the plans promote sustainable change. A shared model across agencies. We absolutely, everything we do in children's services is a multi-agency conversation and needs multi-agency support. And I would ask colleagues to have a look at our 2018 report, Growing Up Neglected, which talked about some really good examples where people had developed that co-product understanding with their partners. Moving on, it's about making sure.
Let's just pause there for 1 second. Yvette. I mean, there's so much in what Yvette's saying there. It's one, it's a real overview. So I mean, do, as James has just said, do fire in your comments, your questions, and so on, as Yvette sort of shares this overview.
Yes, absolutely, and we're up for some conversation lately. I thought it'd be helpful to share. Colleagues often say to me, well, who's doing it well somewhere else? And I'm not endorsing any one place, but just trying to share sort of vignettes of where people are making that difference. I'd also look to Essex, who use their relationship strengths-based practice model. It's fully embedded, it's well understood with staff, and it helps professionals to understand children's lived experiences, really using family strengths to help identify strategies to achieve and sustain that positive change, which I know, colleagues, we all want. But what I would say, and I know is an anxiety in many of those places that are still at early stages on that journey, you need to implement your model well and make sure that you continue to get the basics right. I believe that social work has always encompassed both values and discipline. Our values shape our culture, which enables the relationship-based practice to thrive. But discipline is also important, challenging ourselves to make really good decisions in a timely way in the child's timeline. That collegiate challenge is absolutely key.
Can I ask a question there, Yvette? I've noticed Sandra's made the point there about relationship-based practice takes time, and we're not funded to operate this way. What would anyone's thoughts or your thoughts be on that point from Sandra?
I think I would reflect back on what I've just said about your values need to be enshrined in your structures. So your structures managers need to have spans of control where they're working with the same group of social workers over time, and that you've planned your transitions so that there isn't those constant handovers between teams. So, then you absolutely get that more longitudinal relationship-based work. People, when we're starting off with that first assessment and that plan, and then we start having a relationship with the family, often lots more things come to the fore, isn't it? Assessment and planning is a dynamic state, and that needs a relationship, a trusted relationship, where the social worker is both authoritative but empathetic and understanding and responsive.
Louise, you're asking about tips on co-production with children. Ryan will come on to that a little bit later.
Absolutely. So again, moving on. In local authorities with mature models, we absolutely see that purposeful direct work with children and families as a fundamental key bit of their practice model. And in North Yorkshire, we saw professionals using very sensitive and imaginative direct work to gather the wishes and feelings of children. And so, we need to make sure that all of our colleagues are equipped with the skills to do that. Whether it's motivational interviewing for working with older children. I know we've got a lot of adolescents coming into the system, so we really need the skills base around that, don't we, colleagues? And then thinking about how younger children develop, their ages and what we expect at an age and a stage, so that the social worker can actually see what are the tools. Working with our early years colleagues is really key. That's why utilising all the skills of the multi-agency network is really key.
Yvette, you referred to strength-based approaches, as I did in introductions. There's an interesting question from Laura there, really, about why do you think services have so much difficulty in implementing and sustaining strength-based approach? What's getting in the way? What should we do more or less of, do you feel? Perhaps others have you as well. Anybody? See a blank face.
I could start. So, I'd say, getting those basics right. So some colleagues find it very difficult to do that purposeful direct work because they've got so much on. Yeah. And then there's the skills issue to do it well as well. And then there's, social care is a system which is we worry, don't we, about the pendulum swinging too far with lots of nudging. So what I would say is that the places that are really secure in the handling of that risk can evolve that strengths-based approach.
I would agree with that. It's, James speaking. I think when I think back to when I came into social work, managing risk was something that was felt more risky than it is now. I think we're more comfortable in managing risk now and more assured in managing risk now. And I think that's because over the last sort of 10 years we've allowed one another to use that word, be the experts again, to take more responsibility for a family, whereas a social worker was somebody who was potentially much more anxious about holding that risk. So I think gradually we have given social workers the license, the responsibility to go and hold that risk a bit more. And I think by, as you said, these mature models, I think in Camden we do have a mature set of values and principles, and through sort of holding those as an organisation and pushing those as an organisation, you're enabling people to feel more confident, I suppose.
Okay, well, that's an interesting comment, James. So, I mean, the 110 of you out there, is that your experience as well? More license to take responsibility for managing the risk? Is that your experience? But anyway, I'll go back to yourself, Yvette.
I mean, I would just, if colleagues want to look at a couple of reports, North Yorkshire and Hampshire would be two, where you can see that actually there's been that development in giving social workers the skills to be confident practitioners in terms of direct work and confident about the decision making in terms of adjusting your response over time and managing that risk in a safe way, but in a way it's a bit like I know some colleagues are moving on to work with looked after children in due course. The whole transition to independence for those older younger people. We need to be the dynamic parent that allows them to take risks, and that is the same with families. So getting the support there to manage enough risk and contain enough risk is really important.
There's an interesting comment from Ros there, isn't there, about the years of problem focus. It means that we might be bringing in tools now which are more strength-based, but it's difficult for them to have an impact when they seem to be resting on top of problem, perhaps old-fashioned, outmoded, risk-based assumptions of what good practice is.
Well, that's about. Sorry, go on, Kevin. You want to say something?
Yeah, I was going to say, from my experience as well, I think I found that when I was working with a social worker, the ones that were willing to take the risk for me to be able to learn something or to give me the opportunity to take control of what was going on, I found I ended up working really well with those. And where the relationship was a bit fragile, wasn't really so smooth, was where there were a lot of things that they were recommending, and I found it difficult to understand if that was really what I needed to do. And I even remember being in a meeting and the chair, the social worker was suggesting that I should have loads of observations, and this time I've been around my son for so long, but then I chatted to the chair and I said, what's the point, and when I've been living with him and he's been with me for so long, and then the chair challenged me and said that, okay, let's reduce it, instead of 8, go observe him 3 times. And I think when I think about taking risk, is instead of, I don't know why I felt that at the time they felt that they needed to have loads of observation when they've already seen that I was involved in my child's life and I was always around.
So you wanted us to be flexible and listening to you, I suppose, didn't you?
Yeah, and I think and that worked really well.
I've seen a comment from Helen up there about refreshing training, and absolutely, this isn't delivering a model well. Isn't just having an input at the beginning and everyone getting on about it. It's back to what I was saying about confident practitioners who understand, why we've changed our approach to assessment, or why we're utilising this form and this language, and thinking about the language we use with families. So contact time or family time. How we describe things for families in a meaningful way, and I know Ryan's going to talk about co-production, but I found personally when I was a DCS that the conversations we had, not just with our practitioners but with families, about why we were changing how we were delivering child protection conferences and the language we would use, and what they expected to see at the end of it, was really, really important in terms of building that relationship and taking that journey forward. So would absolutely endorse that.
Okay, sure.
An interesting point from Anna there about Many practitioners want to practice in a relation-based way, but it's about culture and that culture of performance management. So Anna's curious to find out how practitioners can influence management, and in particular senior management who may not have that background and focus more on the quantitative output. Tim, have you got any reflections on that?
I mean, I do think that, yes, Tim from Camden, I do think that different local authorities have different models, have different practice models, and often there's strong buy-in for those models from the top and the bottom of organisations. So there might be people in the front line that I really want to take on the radical aspects of those practice models. They want to utilise the training that they've had, and they want to use the values of that practice model, whether it's restorative or science of safety or systemic, whatever it is. They want to utilise those elements to be able to get out there and work with people in communities. And often, senior managers, in my experience, in organisations who might have made the decisions to implement that model, want to see those results for families and want to see that model be effective. And you've often the frontline practitioner is left to kind of square the circle, where you've got practice managers that are quite rightly holding down the risk and are concerned about the outcomes for children and families. So I think you've got to really work on any model that's implemented has to be done with everybody in the organisation at all levels, and you need to get everybody on board. What's a nice way to get everybody on board? Well, to bring in actually people in communities that benefit, and actually to start drawing up your practice model with those people. And Kevin, you know, being involved in social work, the good results can come from talking to families.
Yeah, I agree. Because I was thinking about like the Camden conversation, which we're going to talk about a little bit later.
Okay. Yeah. Right. Let's get back to it. You see how the conversation's flowing? You're making some really interesting observations there. I wish we had time to pick them all up. So much like to comment on. Yvette.
Absolutely, but I think we've covered some of the this slide in terms of that dialogue, in that where you actually have got that buy-in at all levels. This is not about a DCS signing off a training plan and then not having any involvement, or the front line being trained and middle managers not owning. The whole process culture needs to be everybody modelling these things. And then I think it actually does bring that purposeful work. I noticed there's been a number of comments about the contextual challenges in terms of staffing capacity and finance. That absolutely is an issue. We all know that it's really difficult to access child and adolescent mental health services. It's really important that the local safeguarding partnership is flagging those sorts of issues, and that colleagues across the partnership understand the model that we're operating in social care and the expectations it places on them to work co-productively with families and get the right services at the right time. And just repeating that point that's been raised in some of the questions about it's a learning culture, it's a continuous learning culture, it's not a training event that we went to 3 weeks ago. And all of this leads to more confident practitioners, but also more confident families who are feeling empowered and making the positive changes, or purposeful, timely decisions for another route for those children, and again involving them in their care planning right through to independence.
Okay.
This just, what I would say overall is I see in my role, I see a very positive journey. I see more local authorities really having these practice debates and moving their practice forward. And where we've seen effective relationship practice, we're seeing a positive impact on children and families, with the children's and families' voices heard, seen in the assessments, in the plan, in the work that's going on, and very clear expectations overall. I absolutely know that the context and the environment you all work in is difficult. both in terms of financing and staffing, but I absolutely see a sector that's really rising to the challenges and practitioners embracing the opportunity to make a very real difference for children and families.
Okay, and that's a nice strong way in which to finish, Yvette, so thank you very much for that. And there's your links for contacting Ofsted on the web and social media. Stimulating stuff, Yvette, and a powerful overview, thank you. Ryan, do you want to talk a bit about children and families being at the centre of service design and delivery?
Yeah, of course. So we've already started to touch on this quite a lot, and we started to mention the term co-production. And here at SCIE, co-production is probably at the heart of what we do. So we're a leading organisation in co-production, and we work with organisations to develop co-production and champion equality in social care and beyond. And one of the things that we've been thinking about internally at SCIE is that actually co-production can mean different things to different people. And what does it mean in this context of children's services? So we have a definition that we use here at SCIE, and that's on the screen there in the middle. I think the main thing to draw out from that, which is probably social care practitioners are used to thinking about this, is power. So the standing point that we have is that power isn't equal between people who use services and with professionals. And co-production is a way to equalise that power imbalance. And one of the questions that we've also been reflecting on internally as well, and is part of this webinar today, is how do we talk about co-production in the children's sector? And I'd be really interested to hear people who are on the chat box about what they think about that, because one of the reflections that I have as a social worker is that we often talk about voice, participation, engagement. I don't think there's anything wrong with that at all. But I wonder, do we tend to think about co-production more in adult services rather than we do in children's services? And why that might be. I don't know if there's any reflections here on the panel about that question. How do we talk about co-production in the children's sector?
I think that's a really good point. It's, James, I think we'll talk a little bit more in a few minutes, but one of the events that we held in Camden recently that both Tim and Kevin were involved in, we had Alex Fox came to speak at that, and he spoke about co-production and talked about consultation versus co-production. And I think for me, only more recently in my career, developing a true understanding of what co-production is, I thought, well, we get kids' views, we do a consultation, we decide what we're going to do, and then we go and check whether it's okay or not. Whereas, I think we are developing now the clear sort of vision that to co-produce something, you have to go right to the start. You have to have a blank sheet of paper, and you have to work together with the people whose views you want.
I just happen to have a handy Alex Fox quote, actually.
Alex Fox is the Chief Executive of Shared Lives.
Yeah, Shared Lives, and he's got a brilliant book called Escaping the Asylum, which is really worth looking up. So this is Alex Fox talking about some change in co-production. So he says, for real change to take hold, you need to involve people that don't always agree with each other, and you need a tolerance for messiness. The neater the plan, the more fictional it is. Ultimately, we may need to replace our existing power structures with decision making that feels more like those movements, collaborative, decentralised and human.
Yeah, powerful indeed, yeah. Worth looking out for when you get the recording. Thank you.
So one of the things that we strongly think about here at SCIE is the importance about talking about co-production more, especially in the children's world. And that's led us to start thinking about if services were authentically co-produced in children's service delivery, what might that look like and what might that achieve? So this is a graphic which is a bit jam-packed in hindsight. And what we're proposing here is the two bold titles at the top are potential outcomes that could be achieved by having a co-productive service. So on the one hand, you could have a service which is respectful of family and children's rights. Your service is proportionate, so you're only being involved in people's lives where necessary. And actually co-production can also lead to more of an effective and efficient family service. What we have in the middle there on both graphics is a series of what I call intermediate outcomes, and then below those are co-productive activities. So the idea being that the activities in the bottom two bubbles would help you on your way to those higher end outcomes. And it's important to add that those activities, they're just ideas. It's not exhaustive. It's just some ideas about what you could be doing which counts as a co-productive activity. And I'm just going to draw out a couple of examples so people can feel free to read them at their own leisure. So if we look on the left-hand side there, 2 co-productive activities that we suggest. Firstly, finding ways for families and young people to be involved with the designing, the delivering and evaluation of services. And what I've put there as examples of recruitment and with young advisors. And then secondly, training, support and capacity building staff, young people and families to understand co-production and build confidence to do it well. And I think these two go hand in hand because you can create the opportunities for people to become involved and to share that power. But if you don't give people the skills and the time and the capacity to do that, then it's counterproductive. So how I like to think about it is if a person or a citizen has been feeling disempowered for a lot of their lives, and then you go to share that power, that could be perhaps overwhelming. So what's in between in that middle to help someone along that journey? And the theory behind this is that if you have co-productive activities like this and you're investing in those activities, you can start to achieve those outcomes higher up the chain. So you start to have a system where the voice of the child and family is heard throughout, power is shared, and children, young people and families are empowered, informed and lead on the development of delivering services.
Okay, there's powerful stuff there from Anna, who was picking up what Lee, Heather and Laura were saying about if it's expected practitioners to be operating this kind of way, then they must see senior managers modelling that in the things that senior managers do, which includes the way they structure meetings and management relationships as well. And actually that's quite, as the boss here at SCIE, that's a really powerful statement, I think, for me and how I conduct relationships inside SCIE. So thank you for that. Okay, so anybody want to reflect on anything that Ryan's said there? There's quite a lot coming through.
I wanted to say, I suppose, that you know, co-production and consultation. I think like we sometimes are really good at listening to people really respectfully and listening to what they say. But I think there's a big difference between listening respectfully and attentively, and even going away and responding in some measure to that. There's a difference between that and having a dialogue with people and having a genuine interaction where we're learning together. And I think I think real co-production is perhaps where everybody learns together. I think that's really important.
Yeah, I definitely agree with that. Thanks, Tim.
And I think to one other thing before we move on, there was a question or a message from Sandra saying that something about you know, the critical element in, you know, is changing the attitudes and the narratives in the community. And I think that's, you know, through what you're saying, through being authentic and holding these values, then you begin to change that narrative and change that stigma that social work has in the community.
So I'm just going to move us on because I think it'd be really interesting to hear from Tim, James and Kevin about this in action. So what this is actually looking like in Camden. And what I'm just going to leave you with is just some questions that SCIE are really keen to start a conversation. So what do you currently do? What you don't do? And what you might not be aware of in terms of your own practice, but in terms of your own organisation as well, when we think about co-production. And just lastly, we're going to leave some contact details at the end of this presentation. We're really happy for you to get in touch with us. Like I said, SCIE are a leading organisation with co-production, and we're really happy to continue that conversation. But I'm going to hand over to Tim, Kevin and James now.
Okay, thank you.
All right, thanks very much. Yeah, and I might say something about that photo that you can see on the screen there. People that know us might be able to spot us in there, but we're there with some other comrades and friends as well, from other local authorities. Beverly might be able to spot herself there, Beverly Barnett-Jones there on the left. So there's colleagues, comrades and friends from Walsall and from Southwark as well as Camden. 2 other parent activists that have been really key in developing social work in Camden, Clarissa Stevens and also Faye Hamilton. And all of us are underneath the banner "To Love is to Act" there, which is an important slogan for us in Camden, which will become evident, I feel, as we talk. I guess, like this, the webinar started with a TV reference. If you've just logged on after it, you might have missed that, about the Bake Off. Like the Bake Off, I suppose, is comfort TV, isn't it? It's comfort TV. And I suppose what I might want to say about Camden social work is that it's perhaps it's box set TV. You know, it's rich, it's kind of complex. Sometimes it's hard to understand, and also, and me, Kevin, and James are here to kind of talk a bit about it, give you some thinking points. Perhaps we definitely don't want to totally represent it, represent all of our colleagues and people in Camden's community that are working hard, but we would welcome a continued dialogue after this webinar. And we're going to talk and break it down into 3 areas actually of values, method and practice. You know, in some ways those things blend into each other. I think it's important that the values are at the top there. And we might think about social work being and Camden's social work model, rather than being a sort of fixed model with a ring around it, more like it's a journey. And I like this photo. I don't know, maybe some of you out there will recognise this, some of you might not. When you think of Camden, you might think of Camden Lock. You know that photo of Camden Lock that might pop into your head? And a nice colourful word Camden on is it like a railway bridge, isn't it?
Yeah,
is that right?
Isn't it?
Overground, thank you.
So.
Rhyme doesn't work for Camden. That's what it is for you. So this is Rowley Way, yeah, which is really architecturally very well regarded. And I put that up there because like there's that road off there which indicates a journey, and also there's people there that are living in quite a complex relation to each other, which I think is important to acknowledge. So like we could throw some words in now that might describe the kind of social work that we're trying to do in Camden, the type of sort of co-production that we're trying to do, and hopefully we'll give these words meaning as we go through. And I'll say the words. The words might be systemic, participatory and relational. So I mentioned Camden's social work journey, which is always ongoing and developing. And Kevin, you've been part of that as a parent with experience of social work in Camden, and you've had a journey with your family through our services, haven't you?
Yeah, I think the journey that I've had in Camden, I think what struck me the most, and when I realised the relationship started to kind of move forward, even though it was quite stretched in a way, you know, I didn't particularly just trust them, and I was always curious and wondering. But I remember they were willing to understand, and they were willing to understand my culture, because you know my culture, family setting was very different, you know, and also. And I was learning as I was going along, you know, as being a parent, it's not as easy as some people may make it look. You know, you don't get a dictionary or book to tell you how to be a parent, so you kind of learn as you go along. So when I remember when I was working with Camden, you know, the main thing that I thought was really that they valued was they were willing to understand. And I remember going on a journey, having observation in the community, on public spaces, where, and this is after a couple of years that I've known what social workers do, and you know, having the old dry, sitting in your house and someone sitting there observing you, and you're trying to pretend on how you can be normal while your baby or your little boy is curious of why this person is sitting in the other corner. So for me, that was it was very unique. It was a unique experience. And
I think, if you don't mind me saying, Kevin, I feel very proud hearing Kevin talk, because a bit of a disclaimer, I was the social worker when Kevin, you know, we were working with Kevin, and I you know, when Kevin talks about coming on the journey, you know, I think it was just about, when we're talking about values, I feel really happy now that it meant something to you, that I did come and, you know, watch you pick up your son and go with you to pick up your son and do that together, rather than me coming around at the same time, seeing you in your house, asking the same questions, bringing the child in need plan or bringing the set of recommendations or whatever. Hopefully it was something that, I said to you, where are you going to be at that time? And we were able to, immediately I was putting myself out there, wasn't I, and saying, look, this is me, but I'm happy to be flexible with you maybe. And I think that's what we're trying to do when we're talking about our way of doing social work in Camden. It's about offering a bit of ourselves, isn't it? And trying to by offering a bit of yourself, you're able to build that relationship, you're able to build that trust up, I suppose.
And Kevin, do you want to explain that quote? The success of an intervention depends on the interior condition of the intervener. So you brought that those wise words to us, Kevin. What do they mean to you?
Yeah. So for me, like afterwards, after the whole experience, a couple of years down the line, and when I started to working with James, producing things, trying to understand what journey that went on, it got me thinking about this quote, and it comes from a book on how to collaborate with your enemies, people that you don't really get along with or work with or and it just got me thinking about that. So when I think about that, so this, the success of an intervention depends on the interior condition of that intervener. I felt that at that moment he was gracefully placed in my life,
That's beautiful, Kevin. Gracefully placed.
Whatever was going on, we were able to get through it because when I look back, it was intense, and I remember we met in court. And
like Ryan was saying before, it's about acknowledging power imbalances, isn't it, and trying to address that. I mean, it's almost impossible to totally, remove that because I'm in a professional position. You're there as a family member, but by acknowledging the difference in power, by acknowledging the differences in our cultures and being able to talk and use those as positive things rather than difficulties, we were able to get through it, weren't we?
Yeah.
And Kevin, you're bringing that interesting concept of stretch collaboration to your insights of working with social workers,
and it brings me back to even how I got involved with the Fab Group in Camden.
Do you want to explain what the Fab Group is, Kevin?
So what the Fab Group is, it's a group of parents and family members and family group conferences, coordinators, and some social workers come together and have meetings, and they discuss and they challenge and look at different ways how they can help improve the way Camden is moving forward with the work that they're doing. And that is how we ended up coming up with the Camden Conversations, which I'll talk to you guys a little bit later when we talk about Coproduction. And when I think about, so for me, I remember James, he remembered who I was. And I remember at the time of the court, I was fundraising for a charity, and James remembered that. He remembered that, and when we went apart, he sent me an email saying, "Oh, Kev, I think this is something that you might be interested in." Even though, when I think back, in such complex situation, he remembered that thing about me, and he sent me the Fab Group. And then when I read it, I thought, "Oh, did sound something interesting," and I had to ask myself, do I want to be involved in this? But because I realised the value it could add to my experience being a father and being the being in a room and not really being recognised as a person.
And in turn, Kevin, we are valuing you and the experience that you're bringing. So there's some reciprocity there. Between us and you and us and the community, hopefully. And I suppose what we're getting to with social action, and that's a quote from a piece of writing that my colleague and I, Becca Dove and I wrote, and I'll read it to you. Relational thinking conceives of an individual as a member of a community. Relational uses daily practices to change norms, and relational uses the private sphere for public purposes. In this way, relational activism locates agency in the collective and uses relationships as the locus for change. So I suppose what Kevin's been talking about there is an example to me of how, like, you know, we've got this buzzword relational, yeah, and relationship-based practice in social work. And maybe relational is sort of a bit of a development of that, but, you know, what does that really mean? I don't think relational means sort of being nice. I think it's something active. I think it's about taking action, and I think it's fundamentally the space between people and developing our understandings and our relationships with each other.
Yes.
And James, you want to say something on co-production?
Yeah, we're just. I think, you know, we heard Ryan was talking about co-production before, and I think absolutely it's essential that when we're designing a new service that we're working with a group of young people, we're working with a group of parents to try and think about what the best way is forward. You know, as Tim read out that quote from Alex Foss, it's going to be messy. This webinar, it's best when it's messy because we're all sort of, we're building something, we're building layers on something together, aren't we, rather than it just being, you know, one person giving their views on something. But I think it's really important for me as a social worker that every interaction with a person, a family member, a child is co-produced. I think that for a family member to go and meet, for a social worker to go meet a family for the first time, you have to have that mentality that we're going to produce something together. We're going to listen to you, and we're not going to do just what we want to do. We're going to think about you and think about how we're going to do this together. And I think it's really important to remember that rather than it just be something when we're designing a new service.
And I just wanted to, I wanted to leave you guys with a better understanding of what I meant by stretch collaboration. So what stretch collaboration is? Stretch collaboration abandons the assumption of control, and it gives up unrealistic fantasies of harmony and certainties and compliance, and it embraces the messy reality of discord and trial and error and co-creation. And I thought that's something to think about when you're thinking about collaborating or co-producing with families and children.
I think there's an interesting quote from Lee there about we have to be careful that co-production doesn't become a tick box, and there's conversations about written agreements there. It makes me think back to my practice, what James just said there about every opportunity or conversation or that first meeting is an opportunity to be co-productive. I think often there is this fake narrative that because of risk or because of safeguarding, we can't be co-productive. So often we go with a conversation and we do to families that we don't work with. We don't ask those open questions and say, we're talking about the talk really. How do we have these conversations? How can we work together? I think sometimes there's that fear and apprehension of being co-productive really.
And how do you build, people have talked about how do you build this culture? Well, you know, I suppose examples of that we can talk about. Kevin's already mentioned the Camden Conversations, which was a parent-led inquiry into, you know, the child protection system in Camden. You have to give responsibility to, you know, the people who use the services who can give us their views, and we have to be receptive to that. And you know, some of the events that we've put on recently, you had our Director of Children's Services, Martin, who was there listening to the parents and taking that on board. So you have a very clear organisational openness and willingness to challenge and hear that sort of people speaking truth to power, I think, as Martin said on the day, didn't he?
He did, and I really like what you said, Kevin, to me recently. We were talking about, you know, what is a system, and I might be misquoting you here, but you said that you realised that actually you couldn't take yourself outside of the system. You were in the system, whether you like to, even turning your back on social worker, you were still part of that system. And you felt to sort of turn towards it and to try and influence it was the direction in which you went.
Yeah, definitely. Yeah, I agree. Yeah, I remember saying that and that's why I kind of still try to get involved in some capacity and try to make time for these things, because from my experience, you know, being a father, and I always say this because I know a lot of social workers work around mothers, and they don't really pay attention to where the dad is and who the dad is and who else, if the dad has a family and the people in the family. So for me, that's why I had to put myself out there, you know, even though I had to be active, I had to give a voice, you know, and I was a young father. So that's another thing I like to remind people. I was a teenage dad, so there's a lot of teenage fathers who are unknown, who no one knows about, and then no one knows if they exist or not. So for me, I knew that if I wasn't active in that system, then there was maybe same experiences could continue.
And that fits on well with what I want to say there about the learning culture tip, doesn't it? Thinking
Yeah.
about how, because you've come, Kevin, haven't you? And people from the Fab group alongside yourself have come and spoken to our social workers and talked about some of those
Yeah.
experiences, haven't they?
And I think, you know, and it's about the quality of the conversation really, and the timing of that when that takes place. And also that quote from Becca Solnit there is about, you know, when you start to relate to people and learn from each other, it can be a fruitful exercise, and the Fab group is often a joyous experience, isn't it? And the Camden Conversations, which was Annie from Surviving Safeguarding, Anna Gupta, Professor Anna Gupta, worked in partnership with us and led this. Was 50 people, 25 family members, 25 professionals in Camden about child protection, about the child protection process, and starting from a position of acknowledging that the system sometimes does harm, and having that conversation with people, and we found in respect of, we talked about how can you change the culture of organisations, that we found actually that process, you know, sometimes the process is as important as the outcome, and that journey of Camden Conversations has really helped us learn about each other as professionals and family members.
Okay, we're coming down to about the last 5 minutes or so, so inevitably we're not going to get through all the material, but I think we're all particularly there's some great conversations, great comments from yourselves. What are the things that, in summary, you think you'd kind of take away really that have really resonated in what Yvette and our Camden colleagues have said, and what do you think we ought to together be giving more attention to and learning more about, and you know, sharing and challenging each other more on? Let's begin to draw this together a little bit.
I think if I can say what's really, I've been thinking again and again, I suppose, listening to what you guys said, but also thinking through what we've been talking about.
Yeah.
Value is incredibly important, obviously. We've heard so many people say in the comments there, how do you do this organisation? How do you create this culture? And I think that's been relentless in the messages about this, but also at each level of the organisation, embodying that. We've heard people say that there as well. And I think for us in Camden, you know, those key messages, those key statements, those key ways of hooking and remembering, but also people like Kevin being there and reminding us and telling us to do things, and having those sort of forums throughout the organisation where parents and children can be really clear as to feedback is really important. I think when you're thinking about how you build that culture, you sort of model it at different levels of the organisation, but you model, I think somebody said in there about how managers do things, how managers respond to meetings, how managers chair meetings, and if I, as a manager, am chairing a meeting and I'm not just doing it in the same way I've always done it, and I'm being more creative in how I do that, then I'm giving people license and the responsibility to do things different themselves. And if I'm treating people with compassion and respect in the office, and of course they're going to go out feeling more positive about interacting with a family member in the community.
And we might say about all the, you know, we do a lot of family good conferences, so as much as saying, you know, it's about the values, there are some methods, well-established methods for co-production. Every family good conference is a quality conversation, an opportunity for a quality conversation, and an opportunity for some quality co-production. So we do more than 300 family conferences a year in Camden, and we think that that's a really good method that we would recommend. And I wanted to say just a final thing, and I'll pass to Kevin, but this quote actually, which is another one that Kevin gave to me, right? And it's from Peter Block. It says, if you're working to make the world a better place, there are few experiences more rewarding and useful than having your thinking turned upside down. A shift in thinking is the essence of transformation. It's the basis of renewed faith, and it's the core of great leadership. And so my thought on that would be, you know, what we talked about what is relational, what are relational systems, what is strength based, you know, what is working in a strength based way. And for me, it has to be something that's dynamic. If strength based is us having fixed positives or fixed positive ideas about others' characteristics, or if it's us, strength-based shouldn't be working on the basis of people's pathologies, but also we shouldn't have fixed ideas about people's strengths either. We should learn what are the strengths of people. We should learn that together. So strength-based working should be inherently, as James has said, inherently co-productive, and it should be based on potential. And the best thing as a professional, I think, is to be surprised and to learn something. And maybe that's moving into areas of reciprocity and mutuality, which I think are two important words in I was going to say the future of social work. That sounds very pretentious, doesn't it? Why not end on a pretentious promise? You know. But,
okay.
Yeah.
Kevin, do you want to say something?
No, I think
Sorry.
that's it. Yeah.
Okay, I'll turn to Yvette. You've been listening patiently and looking very carefully at those remarks on the right-hand side. Yvette, you made some sort of powerful, guiding comments as portals of effective implementation, perhaps being more important than practice models, as some people said up there. Have you got any final thoughts and remarks for us?
I suppose I've been studying the comments, and there are lots of people talking about how do we get the environment right internally, and then there are others are talking about how do we make this right for our relationship with families and with children of all ages as well. And I suppose, for me, the two things that were resonating in my mind are sort of confidence and empowerment. Mm-hmm. Our confidence as practitioners, our empowerment to be able to do the best job we can by having that time and space and capacity to do that relationship-based work over time with the family, and then how we apply those skills in that work to, we've seen in Kevin today someone who's been on a journey and developed, the confidence to take up the space and to make, demands of the system in what he terms he needs as support, and to advise the system about how you work to empower other dads in this case to be involved, to be active, and to be resilient and independent of us. So I think all of those words are sort of going round in my head in terms of confidence, respect, empowerment. We're not doing change two. We're empowering people to make their own changes. And I think we can't say that too often.
Absolutely.
Whether we're reflecting internally on staff's journey or our interaction with families.
Okay, well, I think that's a very strong and positive way in which to finish. Hopefully you've made some great connections with each other up there as well. This is a deeply complex, very exciting material as well. I love the emphasis on systemic, participatory, relational approaches from Camden. There's so much more to talk about here. So thank you to Ryan, to Yvette, to Tim, James, and to Kevin. And I think I saw up there, I can't remember who it was, just very easily saying, be passionate. And I think that's what we all really, really want to do to get this right for the people that we're working with. So thank you very much indeed, everybody. A reminder that you will get the slides, the recording, and the list of links to make with each other. I'm now signing off. Tony here on behalf of our panel. We've really enjoyed the hour. We hope you have too. And go forth.